Okay, first question. Most Bay Area counties are getting ready to lift most indoor mask mandates. Do you think it's too early to do so, or is it safe enough at this time, especially with such a high vaccination rate?
So I think it very much depends on the reason and of course, the region that you're talking about. Areas where the case counts are lower, where hospitalizations are low and declining, where there is a high vaccination rate, ideally over 80%, especially if treatments for COVID are accessible and available, then it makes sense to talk about lifting mask mandates and slowly other restrictions. However, the California mask mandate lift also involves that the unvaccinated remain vaccinated. And of course, those who feel uncomfortable, especially those who are in the vulnerable population, who are immunocompromised or who are over than 65 years old, should still wear masks to protect themselves. We will expect that there will be higher breakthrough cases because Omicron is still around. And the subvariant of Omicron may start to infect our population. We expect that there will be a higher breakthrough case count that happens when we lift these mask mandates. However, given that that variant is also mild, then it makes sense to talk about it right now.
And some states are also lifting mask mandates at schools for students and teachers. Is that a safe move?
That also depends on the vaccination rate of the kids at the school, of the case counts and hospitalization of that region. I know that there are some schools that are thinking of a tiered approach where they don't require masks for outdoor settings, but they do for indoor settings if there's going to be a large number of people around. And I think that that's wise.
Do we know yet if the Omicron subvariant can reinfect anyone who's already been infected with Omicron?
It's a good question. So it's too early to tell. The subvariant of Omicron, also called BA2 or stealth Omicron, is known to be more highly transmissible. But as far as the severity of disease, it seems like it is the same severity as the initial Omicron BA1. And in some parts of Europe, it has overtaken BA1. However, prior to this, you absolutely can get COVID multiple times with different variants, and that all depends on your antibody levels. So if your antibody levels are lower because it's been 4 to 6 months since your last vaccine, or about 2 to 3 months since your last COVID infection, then you can get COVID again with different variants.
And my last question, health experts say the coronavirus has been detected in white-tailed deer in Iowa. What does that mean in terms of possible new variants?
So we've actually detected COVID in multiple different animal types. And the first time it was detected in deer in Iowa was back at the end of 2020. And it has not affected humans up until this point. And it was December of 2020 when it was thought that 80% of the deer actually tested positive for COVID. It's very, very rare for an animal to human spread, and the CDC verifies that. Although researchers say that theoretically it is possible for new variants to develop from there, but the transmission from animal to human actually occurs quite rarely. So I don't think we have to worry about it.
Great. Well, thank you so much for joining me today.
Thanks for having me.